Hey everybody, it's Craig Valine here, and I'm with Dr. Ronald Koslowski, prosthodontist in Encino, California. Welcome, Dr. Ron.
Thank you, Craig.
We have a big announcement to make today, and your offices have been open, but you haven't been able to see patients on a regular basis for the last couple of months. So what's happening? As I understand it, you'll be opening your office very soon. Tell me more about that.
Yes, we're very excited about it. As everyone knows, dentistry, except in emergency situations, has been pretty much shut down with the rest of the shutdown. And what was interesting about our dental community is we really decided as a community on the local and on the state and even on the national level, that the emergency doctors, the first responders really needed their personal protective equipment, and there was such a shortage. That was really the main reason that dentistry as a profession decided to close down, except for emergencies. So it's been a tough time for everybody, for patients, for doctors, for staff who had to have their time reduced. So we did it in the spirit of cooperation with our medical colleagues, because they needed our support. And so at this point, 2 months in, even though the virus is not completely gone, we are taking a lot of new precautions to make sure our patients are safe, and we're excited to announce that we're going to start seeing some more of our people starting this coming Monday. Not going full speed, because there are still certain procedures that we want to be very careful about as we learn more and more about what we're dealing with. But certain elective procedures, especially procedures in progress, that could lead to problems. Things could turn into an emergency that's not an emergency now if people don't get their teeth cleaned. Gum infections can flare up, and we've seen it happen. So we've decided it's time to start taking care of people in that group who have treatment in progress and need some follow-up care to prevent complications, and also hygiene care to prevent gum disease that could spread throughout the body.
Excellent. So you've always been, in my opinion, very careful and very precise. When a patient walks into the room, they don't wait long, number one, but it's a small waiting room because you see each patient individually. You don't have a bunch of people waiting around. So it's a safe, healthy environment, if I may say. You can correct me on that word if you want. But one person comes in at a time. They sit there for less than a few minutes, and then they're brought back, and they work with you. So tell me what they can expect. Patients can expect when they make an appointment, they come to the office. What can they expect now during these times?
So some things are going to be very similar. Some things will be a little bit different. And you hit the nail on the head with the low volume of people, because as a prosthodontist, that's really what I've always done, is whenever possible, seen one patient at a time. Try not to have a line of people waiting. Sometimes if there's an urgent procedure that happens, but we're creating new contingencies to make that even that situation safer. And I think that's going to be a harder adjustment for some of the general practices who are used to seeing multiple people at a time. So for us, actually, it's going to be a little bit of an easier adjustment because we're used to working slowly, carefully, methodically, one person at a time. But some additional precautions we're taking. So we've always taken the what we call universal precautions to make sure that that bacteria, viruses don't transmit from one person to another in the dental environment. And And then based on recommendations from the Center for Disease Control, the California Department of Public Health, Los Angeles County Department of Public Health, so we're learning more and more every day, and we're taking more and more precautions. So so some of the basic things you'll see is when you come into the office, we will ask that in cooperation with Mayor Garcetti's order that just came out, where really everyone should be wearing a mask when they leave their homes. So we're going to ask that you wear a mask when you come into the office. If you don't have one, we'll provide one for you. There'll be hand sanitizer, tissues, things like that, at the front desk. You'll also see, I'm not thrilled about it, but it's for everyone's protection. Those fun little sneeze guards that you see at the market now. So we're going to put one up at the front desk. It's not aesthetically beautiful, but it's really for everyone's safety. And but you'll still see a smiling face behind that plexiglass, and unfortunately a little less physical contact than we'd like to see. So. We'll also, and again, for everyone's safety, every staff member, when we come in the morning, we change into our scrubs and wear our, we have laundry service that takes care of all that stuff. So we're not going to be taking, clothes. We're not going to be taking clinical clothing home and bringing them back. So medical linen service takes care of that for us, and we've had that in place for quite a long time. So that's very good. And we'll be taking temperatures too, because we know that one of the first symptoms of a COVID infection, it could be a fever. So staff members and patients, we've got the touchless forehead thermometer. That's also cool, high tech, where it doesn't even have to contact the skin, and we get a 2-second temperature reading. So all these little things just to help out, just to make sure that we're doing all the right things to keep our patients and our staff safe. What else? They should be arriving back ordered, of course, like everything else. But we've ordered some HEPA air purifiers, which should be in place by next week. So we'll have one in each treatment room, and those have a cool UV light incorporated, which has in some scientific studies has been shown to kill virus particles. So we're excited about that too.
Like, you're very prepared, so that's awesome. So you stated that you'll be seeing current cases or people that you were working on prior. What if somebody wants new work done? When will you be seeing them, or are you seeing them?
Depends on the kind of work. So we are keeping the schedule lighter with more buffer time in between patients. So time allowing, we are giving, starting off the first few weeks, we're giving priority to patients who are in progress, and also preventive hygiene type appointments. New patients were always available to see. In fact, what we're implementing now, which I think will be great for everybody, is initial consultation, which usually involves a discussion of concerns and discussion of history, of dental history, health history. We can do all that virtually, just like on a platform like this. Zoom is the one that I use, and that can be a good way to just get to know each other a little bit and learn a little bit about patient concerns before doing our dental exam in the office. And that goes for existing patients too. If there's just a concern to discuss, if something new is coming up, and we want to discuss symptoms, or just have me take a look in 2 dimensions rather than 3 before coming into the office. That's something that we offer on a complimentary basis for now. So so we're excited about that too.
On a personal note, what have you and your staff been doing for the last 2 months in the office?
Okay, so we've not, well, I can speak for myself. I haven't been sitting around watching reruns of The Office, but
I have.
But we have had family time. So it's been, so I've been trying to look at this as not a curse, but a gift, spending time with family. So I have my my two little baby daughters are now 18, and my big girl is turning 20 in a couple of weeks, which I can't believe.
Wow.
And she's back from college because college is only in session online. So we're spending some family time. We're having more family meals together than we've had since they were little toddlers, I think. So
Wow.
that's pretty neat. I've been also meeting with my staff regularly. So we wanted to make sure that when you call the office, there's a live person to talk to during our regular hours, which are Monday through Thursday, 9 to 5. So we've made sure that there's one staff member in the office at all times to answer phones, do some scheduling, and unfortunately some rescheduling too, as we've had to push out our open date. And then keeping the whole staff in touch and engaged on Zoom. And we've been discussing our plans to make sure that we're taking good care of our people when we start up, and discussing those kinds of strategies, and discussing what we need. And of course, the personal protective equipment, making sure that we have an adequate stock of that. I'm actually going to be this afternoon running over to the San Fernando Valley Dental Society office to pick up some disposable gowns, which we'll need once we get into full swing of things, procedures that we're going to be putting off, or procedures that create aerosols of fluid in the air. So we're going to have to wait a little bit on that, but the disposable gowns will be part of our protective equipment for that. And of course, the N95 masks, which are in short supply. So we have a starting supply of that as well, which is good. So it's going to be a constant thing. So we've been discussing that with the staff, strategy of making sure all those things are in place. We've also been studying together. We thought this would be a great opportunity to study Stephen Covey's 7 Habits of Highly Effective People, which was a book that had been on my shelf for a while, and finally dove into that. A great wealth of information. And what surprised me about that, Craig, is that book is more applicable to home and relationship life than it is to even business, or equally applicable. I thought it was a business book, and I started reading and I realized, oh my gosh, this is about how to have a relationship with a spouse or significant other. This is about how to have a relationship with your kids, and how to be effective at work. So all of the staff got a lot out of that, and it's continuing. We're not even done with that yet.
Yeah, I have to read that book. I haven't read it in 20 years, but I'll have to pick that up. Well, excellent. So just a reminder, you're going to start seeing patients on Monday, May 18th. And if people want to schedule an appointment, they can call your office, 818-986-9036. Any last words for the viewers?
Just that we're excited. We miss all of our patients. We miss our referring doctors, and we're excited about getting back in touch.
Excellent. All right. Well, a reminder, if you want to schedule an appointment with Dr. Koslowski's office, please call at 818-986-9036, 818-986-9036. Thank you very much, Dr. Ron, for being on the line today. I hope that the practice gets back up and running fully, and I know it will, but I hope it's a smooth transition for you.
Yeah, it'll be a little transition time, and then we'll be back.
Yeah, I look forward to it. All right, everybody. Thank you very much for being here today. Thank you, Dr. Ron. We'll see you next time. All right.
Take care. Thank you.